with today's session, I just wanted to briefly mention 3 upcoming webinars that the foundation will be sponsoring in the coming weeks. On July 23rd from 1 to 2:30, we'll be running Understanding Financial Health and Planning Ahead in a Time of Uncertainty. The presenters on this will be FMA out of New York City. They're nationally recognized as some of the best consultants working on financial planning for nonprofits. They'll be covering how to ground your financial decision-making in your values, understanding your current financial position and what resources are available, levers to increase resources available for immediate response, and tools for cash flow for the short term. We'll also on June 25th from 1 to 2:30 be running No Event Fundraising with Sharon Donofsky. Obviously, we know nonprofits rely on events and galas to raise money, which unfortunately is not going to be possible for the foreseeable future because of COVID-19. This webinar will focus on how to build strong relationships with your current donors and engage new donors in order to raise the funds necessary to keep you all working towards your mission. We'll also on July 9th, again from 1 to 2:30, be running Communicating Authentically with Your Donors. Again, this will be ran by Sharon Donofsky, and it'll really teach you how to develop a communication strategy for your donors based on your authentic voice, your impact, and your real need. All these sessions are going to be completely free, and we'll be sending out a follow-up email to this webinar, which will have the full descriptions as well as registration links, and I encourage everyone to sign up. I also wanted to mention that today's webinar is really just the beginning of our conversation. Today, we'll cover a lot of information about what to consider when you're planning to reopen, but we also want to make sure that we provide time for you all to discuss this information with your fellow nonprofit leaders and colleagues. So next week, we'll be using Zoom breakout rooms to host a follow-up peer discussion session. We'll break into small groups based on employee size and mission as best we can, and we'll allow folks to share their plans, questions, and concerns with one another. This conversation will be same day, same time next week, Thursday at 1 p.m., and we'll also include that registration link in the follow-up email. Additionally, that email will also include a planning template, an example to help guide you as you're creating your plans based on information from today, conversations you're having with other nonprofits and agencies, and really what makes sense for your individual organizations. We'll also include information about acquiring PPE. The state has a limited supply that they have made available, and we'll include information about how to make those requests for your organization to the state. Additionally, the foundation is also looking at different options to make PPE available to nonprofits in our area. And we'll have some more information on that shortly. And thank you to everyone who filled out our survey last week to help us with that. With that said, we'll move on to our session. We're going to ask everyone to stay muted. And if you have any questions during the presentation, please submit them through the chat box, and we'll try to answer as many as we can during the Q&A at the end. And now I'm happy to introduce our presenter, Nick Daukas of KardasLarson Human Resource Consulting. Nick has over 30 years of operations, human resource leadership, and consulting experience, and he's helped a variety of organizations and companies build high-performance teams, effectively manage cross-functional resources, and align organization goals and direction to ensure quality outcome. Nick, thanks very much for being with us here today.
Well, thank you. Thank you very much. Thank you for having me, and really look forward to our time together. So, Patrick, if you could go to the next slide. Just a real quick, a little bit about KardasLarson, who we are. So we were founded in 2004, and we provide human resources consulting to small and mid-sized businesses, nonprofits, and municipalities. And we focus in on both strategic and tactical HR-related work. And we do it on site. So for instance, a very small organization will outsource the HR function to us, and we may be scheduled to be on site at their facility once or twice, 1 or 2 days a week, or virtually or as needed. We do our work on call, retained, and we also do project-based HR related services. So if a small organization needs additional resources to help through a project, we can do that. And the main areas we focus in on are general HR and compliance, things like audits and handbooks and policies and employee relations activities, investigations, those kinds of things. training and development. So we do, whether it's required training like sexual harassment training, as well as we'll do customized training around things such as management development, leadership training, organizational effectiveness. We do employee surveys, we do performance management systems, succession planning systems, anything to help drive the performance of an organization. Talent acquisition and retention. So everything from contingency and retained search to job board posting to recruitment and hiring process type design and retention programs. Compensation, so we will market price positions. We will design compensation programs like salary grade systems, bands. We'll also do things like bonus plan development, those types of things within the comp area. And coaching, everything from executive leadership coaching to management level, career coaching. We do 360-degree feedback systems. So anything you can think of that would fit within the coaching area. So that's just a quick little intro about us. Probably about 35% or so, maybe a little bit more of our work is with nonprofits. So thank you for moving to the next slide. So what we will be doing today, now that phase 1 is in place in Connecticut, let's talk about how you can be prepared to get your workforce ready and also your workplace ready. And we'll go through those two paths. They'll you know, as you're working on those things, they'll be in parallel. We'll do it today. We'll do workforce ready focus first and then the workplace second. But a very important piece is that because the workplaces are reopening, it doesn't mean that you can't continue to have employees work remotely. There have been a lot of recent studies, a lot of productive work is happening remotely. And there are some organizations that have come right out and said that they're going to continue to work remotely, the vast majority of their employees during the rest of the summer. In fact, at the bottom of this slide, there's a link, and a lot of the slides I've included links for more detailed information for you to get that type of info. But this one is a link to the Hartford Business Journal last week, where Aetna announced that they will primarily continue remote work through the rest of the summer. So we're going to talk about how to get everything ready to come back, but you don't necessarily have to do that in every phase. So thank you. Let's move on to the next one. So let's go down the path of getting your workforce ready. This is kind of like identifying the types of employees, the first couple of slides here, and how you will identify which to bring back. So there's some good definitions of employees here, because it may give you a different approach as to how you're going to determine who to bring back. So furloughed or laid off employees, you'll be bringing them back or maybe bringing them back. You'll be considering your employees who are working remotely. Maybe you'll be bringing some of them back either during this phase or in future phases. And maybe you'll be bringing them all back, as well as in some cases, you'll be hiring new employees. So a little bit different paths on some of these that you may want to consider, and we'll get into that in a minute. But the approach should be pretty general. Similarly, there may be some fine tuning depending upon which employees you're looking at. So if we can move the slide, thank you. So first consideration is, which employees will you bring back? Some organizations are just going to bring them all back. Some organizations are considering, well, should I just do it by a certain role or department based on which part of my organization or business I'm going to reopen? And some some clients have asked, do I have to bring back everyone? What happens if I have an employee who is, there's performance issues, attendance issues, those types of things. And well before the pandemic, I was having challenges with them. So you can, decide what criteria you're going to use. You can look at by department or role. You can look at by tenure. Maybe you bring back all your long tenured employees first. You can consider performance, a particular skill set you're looking for early on in the process. So whatever the choice you make, just remember that make sure there's good business reasons and you can document those reasons, because on a couple of fronts, you're going to need to be able to respond to employee inquiries and potentially prepare for complaints down the road, especially if you are going to decide not to bring back some of your non-performing employees. So remember, criteria and business reasons, have a business case put together as that will document your decisions. And I'm going to talk a little bit about this more later as well, but in a lot of the information that has come, the Reopen Connecticut information from the state, from the governor's group, and from other states and the federal government too, there's been, for good reason, there's been a lot of conversation about those who are ages 65 or older and those with pre-existing conditions should not come back. They should stay at home. So remember, your decisions cannot be potentially discriminatory by discriminating certain groups, by treating certain groups differently based on age or disability or medical reason. So just keep that in mind. On the one side, we want to protect those groups, but on the other side, we have to remember that we cannot treat them any differently. Okay, Patrick, thank you. So let's just kind of quickly go through furloughed, laid off, or remote employees and how they're different. So laid off employees are employees that are terminated. They're no longer employees of yours. They're not on your payroll. When they were laid off, they received, depending upon your programs, they may have received a payout of paid time off benefits, for instance, like vacation, the whatever health and welfare benefits. Maybe they're on COBRA right now, for instance, but they are terminated employees, and they are obviously they're eligible for unemployment benefits. A furloughed employee is an employee that is not working, has not been terminated, is still active on your payroll. They also can receive unemployment benefits. And they may also be receiving other pay and benefits under the Families First Corona Response Act, the FFCRA, which is the paid sick leave and the expanded family medical leave. But they are still eligible for unemployment, like I mentioned, but the main difference is that they're no longer an employee of record of yours. And then remote employees are current employees, have all the same benefits going as they were working in the office, so to speak. So a couple of things to remember, that when you laid off an employee, if they received any payout of vacation or whatever your paid time off program is, when you bring them back, will they have any? They may have none for the rest of this year. Or you may want to look at a program that you can allow them to borrow into the coming year, into this year. So just consider how they were treated when they were laid off and how any health and welfare benefit programs were treated when they left. So as well as furloughed employees, maybe you continued paying for their health insurance as an example, or did they continue to pay their portion? So these are the considerations to look at when you plan to bring them back, how you will treat these things. And sorry, if you go back, Patrick, just pointing out that there's additional information about the FFCRA benefits. There's a link here on this slide. Okay, thank you, Patrick. Another consideration is, what if you have any policies right now, any hiring or rehiring policies? Are you going to continue to use those? So some organizations have rehire policies where it has to do with gaps that have elapsed. For instance, if someone is rehired after 90 days or 6 months, you know, their tenure, for instance, is grandfathered. They don't lose tenure, which would drive some of the things like pay time off, et cetera. So consider that, and looking at what will you do when you bring those laid off, for instance, employees back. Will you, if your hiring process has criminal background checks, education checks, drug screens, what will you do in those situations? Will you do those? Will you not do those? If you do have a rehire policy, it may have information about how those types of, the type of hiring process will be treated in that case. There's a little asterisk there and a link with regard to Connecticut's statute on if you do pre-employment drug screens. So if you rehire or recall an employee within 12 months from the last time that they were hired and therefore had a drug screen, you cannot do another one. You have to, it's beyond the 12 months that would give you that opportunity to do that. And then what about if you're going to be bringing them back virtually? How will you onboard them? There's different treatments about different pieces of onboarding. For instance, I-9s. There's a different way that the federal government has allowed to do I-9s virtually. So all of those considerations need to be thought of and included in how you're going to bring your employees back. Same thing with health and welfare benefits. So, you know, are your remote and furloughed employees, chances are they still have their benefits in place because they're still employed. How, for instance, a furloughed employee is paying for it, that would be how you treated it in that at the time. So that needs to be considered. Laid off employees, there's new IRS guidelines. They came out about a month ago, or give or take. If you have a Section 125 cafeteria plan requirements, things around like health insurance, you know, typically you have to wait to make changes. You have to wait until the open enrollment period to make such changes. So the IRS has allowed those types of changes during this program, or during this pandemic, sorry. So consider that. FSA programs have been relaxed as well as if you have high deductible health plans. So there are certain things that are now covered in the IRS, has relaxed some of the 125 requirements. So ensure that you're prepared for those kinds of things as you bring your employees back. And then I mentioned earlier, how will you handle pay time off programs for laid off or furloughed employees, depending upon how you handled them when they were laid off, for instance? Have balances been paid out? Will you, based on your policy, will you just communicate to employees that they will have no further PTO or vacation, for instance, through this year? How will you handle that in advance? So before the first day of returning, recommendations that I have and many have is issue a new offer letter or letter of hire. I'm sure many of you did that when you originally hired people. So when you're bringing back laid off or furloughed employees, I would strongly recommend this letter and cover the very important pieces of what the job title is, what the rate of pay is, start date, schedule, hours, benefits that they would receive, especially if the PTO programs are different, and then include what I call an employee pledge, right in the area where they would sign that says, I've not experienced COVID-19 symptoms in the past 10 days. I'm not caring for someone with COVID-19 or caring for someone who is experiencing COVID-19 symptoms. So include that in this offer letter or hire letter. And then next is to determine how you will handle daily health check requirements. So in the Connecticut Reopen Connecticut guidelines, each business sector talks about a daily health check. So some organizations are asking employees to actually sign a document every day that they are not experiencing COVID-19 symptoms or caring for someone who has COVID-19, et cetera. Some organizations are not going to that extent. Some are having a notice posted. They're asking employees to self-check themselves and do kind of the honor system to let the employer know if they are experiencing these types of symptoms and do not come to work that day, for instance. So it really kind of depends. There isn't anything that requires you to have them sign off. It's kind of a risk assessment. Are you, by having the employee sign off, you can, show that you've made every full faith effort to ensure that your workplace is healthy when they come in every day. So it really kind of depends on your culture and how you want to go about handling this daily health check requirement. And then all of the Reopen Connecticut guidelines, which there's a link here if you don't already have those, need to be followed. So all the general guidelines, 50% capacity, strict cleaning and disinfection protocols, those who can work from home should continue. I'll go through a little bit more detail, but face masks and social gatherings, meetings, nothing greater than 5 people. But all of those guidelines need to be followed and prepared for before the first day. And then one of the more common conversations has been, what will we do with regard to, will we have a temperature check? Will we conduct temperature checks with employees? A lot of organizations are doing that. Some organizations have chosen not to. It is not a requirement. So we're going to talk a little bit further more now on the temperature checks. So if you could go to the next slide, Patrick. So some recommendations if you choose to go with the temperature check. Use an on-site medical professional if possible. Otherwise, you want a manager, supervisor level employee to do this. Use appropriate PPE, so recommendations for conducting temperature checks. The person who's doing it should have a gown, be fully masked, gloves, have some form of eye protection. Use a thermometer that does not have direct contact. So for instance, an infrared forehead scanner would be the choice. Consider temperature check each day and each shift. Critical point is maintain confidentiality in both the process, so how it's being conducted, and also what records are being kept with the results. The CDC guidelines on the temperature is 100.4. So what some organizations have done, a good recommendation I like is it's either a yes or a no. The record shows a yes or a no. The record, does the employee have a temperature of 100.4 or more, yes or no? That just minimizes the confidential information that you're tracking. But all of that information needs to be recorded in a very confidential manner and has to be maintained in a very confidential setting. You know, just as you would with your employee files, employee information, you separate any kind of medical information from other information that you have with employees. So the same type of care should be taken in this situation. That's one of the reasons why having a manager level person to do it will help keep that information confidential. You know, there's a lot about this. Does it really help? Because as many of you know, I think it's anywhere from 25 to 30% of people with COVID-19 are asymptomatic. So they don't have a temperature, they don't have other symptoms, or it can take 2 to 5 or 6 days for symptoms to come out. So, you know, is a temperature check a foolproof method? No, it is not. It is on 2 accounts. One is that it does show proof that the employer is making every full faith effort to maintain, you know, health and to prevent a direct threat to their employees. The other piece is that there's been some information I've read that employees just feel better, that they're working, you know, within 6 feet of their fellow employees, and that no one, at least on that day, has a temperature. So it's a risk assessment. It's kind of a, you know, what best fits with your organization, your culture, et cetera. And at the bottom of this slide is a link to the Equal Employment Opportunity Commission, the EEOC, where it has a lot of information about this and about information with how the pandemic, with regards to the Americans with Disabilities Act and a few other areas. Prior to the pandemic, a temperature check was treated by the EEOC as a medical physical almost. So prior to the pandemic, there had to be a you know, job-related reason and a business necessity to do a medical exam. But so that was relaxed during the pandemic, and temperature checks are allowed. So we can move to the next slide. Thank you. So that kind of covers how to get your workforce ready. Now let's start to look at how do you get your workplace ready. So the sector guidelines that I've already spoken of, make sure that you have downloaded and prepared for those guidelines. You know, there's different sectors: offices, retail, restaurants, museums, salons, and barbershops, and others. The general guidelines are the same as far as social gatherings, you know, 50% capacity limits, face masks, work from home if you still can. All of those are across the board, but there's a few little differences among the various sectors to look at and be prepared for. So what must be done? So maintain a log of employees who come into your premises. This is, for a lot of business, this is something new, but this will help when it's time for any contact tracing that may occur down the road. If you find that you have employees with that end up with COVID-19. So this is a very important, maintain a log every day, every shift, if you have multiple shifts. Continue to remote work for those that can. So really take a hard look at what still can be done remotely, what is being done very productively, ensuring that, platforms like this, Zoom or Skype or whatever, can still be employed to be able to get work done. Create a plan to reopen. So a lot of what we've covered already and what we will cover as we keep going on this, all of those things should be in your plan. What are you going to do? How are you going to do it? What shifts you're going to open? What jobs you're going to have? You're going to have all employees back. All of that should be part of the plan. The plan should also include things like, are you going to rearrange your physical plant? Those kinds of things. So the program administrator, which is what is part of the reopening process, is kind of the go-to person, not only to own the plan, but to ensure that pieces of the plan are being done properly, and when there are issues, to bring it to that person for any kind of to fix any of those issues. One of the first steps is employers must certify prior to opening with the DECD, the Department of Economic Development. You do that online, you go through a process, you get certified by them that you can reopen, and then you'll get like a badge that gives you that certification. You can display that badge in your workplace that you have gone through and met the requirements to reopen. Go back one, please. Thank you. And some of these other things that we've covered, but maximum 50% occupancy level for phase 1. It will increase in phase 2, which I think is slated for June 20th as we speak. Consider staggered shifts. Have 20% on one shift, 20% on another shift. Break it down that way. Conduct training of employees and retraining, and the training would consist of things like proper cleaning and sanitizing protocols, making sure that everyone is keeping within or at least 6 feet away from each other. Employers provide face masks. So I know Patrick already mentioned, trying to get access to more masks. So that is one of the items in the Reopen Connecticut. No groups or meetings of greater than 5. I think that increases to 50 maybe on June 20th if the state meets the next phase requirements. So, meetings, continue your meetings using things like Zoom if you can't do 5 or smaller. Follow social distancing requirements. Really, this can be kind of challenging in an office situation. So, the detail around this is, if you're in a private office, that's great. But if you're in a kind of an area where you have a bunch of desks or cubicles, that can be kind of challenging, and that your physical, how you are organized may have to change. If you could go to the next slide, please. Okay, post clear signage that reinforces the protocols and the policies. And the signage must include the United Way 211 complaint line. So this is one of the few times where the state does not provide the required signage or poster. The employer develops their own. So it should include all of the safety protocols, all of the safeguards you've employed, the requirements that you're following. Limit visitors. Some organizations, you know, kind of their entry lobby area, they've shut down during the pandemic, and some of them in phase 1 will not open it up. They won't allow visitors in. Provide adequate supply of hand sanitizer, have hand sanitizer stations throughout. So that would be, that's a requirement. Air ventilation, one of the requirements is to increase air ventilation throughout the facility. And that helps kind of clear the air, move things around so that any kind of virus or whatnot, it's hard to settle. So that's another requirement. Break and meal periods. There are some organizations that have cafeterias, for instance, that will not open up again. Some have break rooms that they have taken the chairs out of. No chairs allowed in the break rooms, and that really forces employees not to mull around and not to stay in the area. As far as lunch or meal periods, some organizations are saying you have to eat outside, go to your car to eat your lunch, for instance. So, you know, these are, this is part of your plan and part of your consideration prior to reopening to make sure that all of these areas you have answers for and that you're ready to communicate to your employees. Okay, next. How will meetings be handled? We kind of talked about that already. Provide partitions in the office. I hear there's a run on plexiglass. A lot of offices have been buying plexiglass, and I hear it's really hard to find now. They've been using plexiglass in food stores and whatnot for cashiers. So, but try to partition workspaces, rearrange office space, the arrangements. Do not allow shared equipment. There's a lot of offices will have a large printer that 10 or 15 people will use. How will you handle that? Because you can't have a lot of people going to the printer at the same time, or you want to minimize that. Discrete work zones. So make sure you have people coming and going hallways. Some organizations have elevators if they're more than one floor, and what they've done is they've identified that, you know, if you are no one below the 4th floor can use the elevator. You have to use the stairs unless you have a disability or a reason to. Some organizations, their elevators are very small. They only allow one person in the elevator at a time. So it's very, very challenging to plan this out, but you must, and you have to really kind of consider all of these pieces. Remove non-essential amenities. If it's not needed, it goes away. Again, social distancing, we talked about using elevators. Install touchless appliances where possible. For instance, soap dispensers and paper towel dispensers. So, you know, the ones that you just kind of wave your hand and the paper towel comes out or the soap comes out. You know, consider what you're going to do with that. There obviously is a cost issue with those types of things, but how will you minimize your employees touching the same thing? Making sure that things are clean and sanitized. And social distancing markers. So markers, you know, arrows, lines that you see this in the stores, for instance, where it says 6 feet, you know, so you know where to stand, that you're not closer than 6 feet. So let's talk about, we talked a little bit about this earlier. So workers with pre-existing conditions, and they would be, you know, high-risk groups that have been identified by the CDC, have been identified by state of Connecticut, those over the age of 65 or other comorbidities like someone with diabetes or asthma or any other kinds of those types of illnesses that that this virus tends to really affect more than those without. Should, if they can continue to work at home, it may not be a bad decision to do that. But remember, you can't delay bringing back someone or rescind an offer of employment solely because they are in one of those groups. It could be discriminatory on its face. So work with your employees. You may have employees who don't want to come back, and they actually say to you, I have a pre-existing condition. I'd rather not come back. If the work can continue to be done remotely, maybe that's the best choice. And you may have employees on the opposite side. They are over 65 and they want to come back. They are tired of being at home. They want to get back into the office. So just flexibility is very important in this time from the employer's perspective. Work with your employees, kind of come up with an agreed to solution together on how to handle these things. And remember, just be non-discriminatory in your activity. And some other important considerations. If you don't have an employee assistance program, an EAP, now is the time to get one. They're very helpful, very important. If you don't have one, whether it's your health insurance carrier, if you use a benefit broker that can help with that, these are very important. There's a lot of information out that there's a lot of mental and behavioral pressure on people now with this. And I read something recently where doctors are prescribing a lot of anti-anxiety medications and whatnot. So, EAPs, that's one of the things they provide. They provide the behavioral health resources. So it's very important, if you don't have that, to really look at adding an EAP. And if you do have it, make sure that you really have communicated the EAP to all of your employees and over-communicate how it is very important. It's free of charge, depending upon the program. Usually there's a couple of free sessions. It's confidential. So really push the positives of that for your employees. Look at your current health insurance plans. Look about the mental health resources. Look at what can be done maybe to increase those for employees. And we've mentioned this more than once, but communicate. Very important to have continuous communication and to utilize various modes of communication to all of your employees. And that is where we're at. And we're ready for a Q&A, I guess, right, Patrick?
Yep, and we have a couple for you already, Nick. And again, please, anyone, if you have questions, just put them right into the chat box and we'll get through as much as we can. One question we have, actually, it's a couple we've received in the pre-questions as well, for folks who work outside at a nature preserve. Will meeting DEEP guidelines for state park employees be adequate and legal?
What kind of guidelines?
DEEP.
Oh, so as long as those meet the Reopen Connecticut guidelines, so the social distancing and all of that, they should be fine. Outside, there's seems to be better to handle this outside. That's why restaurants have been allowed, their outside areas have been allowed to open. So as long as it follows Connecticut and CDC guidelines, it should be fine.
Another one, will OSHA require that every employee have an N95 mask, and fitting and employer training on this?
So there is no OSHA requirement on that. The N95 mask is not a requirement. It's a facial covering, and there's guidelines in the Connecticut Reopen. There's, it has to be cotton-based, I believe. So there's certain things, but the N95 is not a requirement, and OSHA does not require a mask. The mask or the face covering is come through by the various states and has been recommended by the CDC.
Nick, as far as travel goes, we have a lot of organizations who do work off-site. Should folks be getting in cars together? How should they handle that off-site work and traveling?
So I would say, prior to last week when we had the first phase of the opening, the best decision may be to continue as to how you were doing it previously. Travel, especially more than one employee together traveling, the social distancing may be an issue. Can the work be done, using Zoom or Skype, et cetera? So that's how I would recommend, as far as the travel goes. But it depends on the business. If the business really, it's a business necessity, then, if you're going to have multiple employees travel, I would recommend that they travel separately to be able to meet the social distancing guidelines.
Got it. Another one, Nick. We have a nonprofit that is an essential business and has never closed but reduced staffing and taken the precautions necessary to meet the CT office requirements for phase one. Do they still need to certify?
No, they don't. An essential business that has already remained open, they do not need to certify. And there's been, the Connecticut.gov, all the information on this has been really good, and there's a number of Q&As around that, so they do not need to certify.
Nick, you talked about it a little bit, the importance of communication. Do you have any specific strategies or different means of the way people should properly be communicating their plans?
So I would, larger organizations, probably the best approach would be to communicate information through the leadership down to the employees, and then have maybe a specific time frame, whether it's biweekly, bi-monthly, where maybe the executive director does a larger one. But it can be done and it should be done in multiple modes, whether it's something like a Zoom, conference call, email, however it can be done. But it's almost as important how frequently and the mode it's done to make sure that you hit everybody and pass on the important information. That's just as important.
Nick, is the employer liable if an employee or a guest gets the virus?
So there's been a lot of conversation about this. I don't think there's anything that says either way. I think one of the last legislations that was before Congress, there was a liability piece in that legislation, and it didn't pass. So I think there's, I think the best thing an organization can do is to make a full faith effort that they are following the guidelines, that they're communicating to their employees, that they're asking their employees that, whether they are, experiencing symptoms, they're acting upon it if they are, and go above and beyond that if you would like, for instance, like a temperature check. But there is not a 100% yes or no on the liability issue.
Another question regarding traveling. Are there any restrictions for employees when traveling with volunteers out of state? And should there be new policies at organizations put in place for such travel?
Well, I guess I would go back to, look at the social distancing guidelines, look at the guidelines. Can that be done traveling together? It may not be. And as far as volunteers go, I would tend to think that you would need to try to do it separately, if at all possible. And then finally, the question is, do you need to travel?
Mm-hmm. Nick, testing, is it possible for employees to make that mandatory? How have people been handling testing?
So there is no mandatory testing at this time. To answer that question, some of the tests, I'm sure everyone knows that over the last 2 or 3 months that we've had different kinds of tests. Some tests have proven to be more accurate than others, and I think that's the main reason why there is no mandatory testing. And then the other thing too is, only health professionals can do the tests, and only certified labs can do that. So it's really kind of difficult, unless an employer is a healthcare center or a hospital. Very, very difficult to do that. So there's no requirements for testing, and I think just my assessment is, testing has changed, and I think today versus 2 months ago we have more reliable tests, but there isn't that one definitive test.
Got it. All right. Well, I'm not seeing any additional questions. Actually, we have one more coming in, and I think we have time for one more. If employers currently have staff filling out daily health check assessments with temperatures and other COVID-related questions, as more folks start to transition back to work on their campus, they're starting to explore the idea of using 1 page per staff that would cover multiple days. Is this a viable idea? Have you heard about this, or you have any other ideas for getting those health check assessments all squared away, Nick?
So do you mean that there's one health check assessment for each employee, or there's multiple employees fill out the same? I'm trying to follow that.
Yes, 1 per employee.
Yeah, I mean, that's certainly one option. That's a little bit more, definitive than leaving it up to employees to self-check, to let you know if they have a symptom. So that seems to be a reasonable approach. There are, certainly employers that are taking that approach.
All right. I think we have time for about one more. If you have an employee who's over 65 and has pre-existing conditions, they've been paid their full wages during this time, but unfortunately the person cannot perform their job from home, how long is the organization required to keep paying that person before letting them go?
So at this point, what you can do, and what you could have done previously as well, is that the FFCRA, the Families First Coronavirus Act, Families Act, they may be able to fit into one of the 6 categories for paid sick leave. So that's one option to look at. That need to spend a little bit more time getting into the details on that, but that is one, because if a healthcare provider has recommended to an employee to kind of segregate themselves because of a pre-existing condition, that may meet the requirements to receive paid leave. And there's certain amounts of how you get paid and that kind of thing.
Great. All right. Well, again, I want to thank everybody for taking the time to be with us this afternoon. Nick, I want to thank you for providing really good information. And just want to remind everyone, we're going to have a follow-up email coming out either today or tomorrow. Please take the time to fill out a very brief survey in regards to today's session, and also to help us plan future webinars, trainings, and different means of helping you all out to get through this uncertain time. And again, there'll be a lot of resources in that email. We're going to include the template for a plan, so you can help, you know, take this information and really craft something that you could provide to your employees, as well as additional webinar signups. And above all else, if the foundation can help in any way, if you have questions, concerns, please don't hesitate to reach out to any member of the staff. We really appreciate all the hard work you all are doing, and I'm sure we'll be in touch soon. So thank you again to everybody.
Patrick, can I just say one last thing too?
Please, Nick, yes.
So this last slide, you know, feel free to go onto our website or check our social media links. There are many, and it's free. There are many pieces of information that you can download. You can go on and find or get in touch with any of us if you need. So thank you very much. And thank you, Patrick and the foundation, for having me.
Thank you, Nick. Be safe, everybody.